Hi, this is Dr. Paul with Car Injury Care TV. It's the internet show that answers the most common questions regarding automobile accident injuries, medical and legal. And today we're talking to Dr. Greg Hollstrom, chiropractic neurologist here in Largo, Florida. And the question we're talking about today are, how are automobile injuries compensated? So, Dr. Hollstrom, you see a lot of automobile accident patients, is that right?
Yes, we see, over the years, we've seen numerous.
Okay. Can you give a rough outline to start with of what is involved with the compensation of an automobile injury?
Okay. With the first category being...
If we were going to look at medical expenses first, how would the medical expenses and the permanency of an injury relate to the compensation?
Okay. The compensation is involving a complex equation involving whether a patient at the end of their healing has been left with a permanent impairment. And this is done at a time which is referred to as maximal medical improvement. And by definition, maximal medical improvement is when a patient will show no further improvement under the care of any type of provider. At that time, a physical examination is done and a decision is made as to whether there is any physical impairment. Now, to understand physical impairment, 0% impaired would be perfect health. And 100% impairment would be the patient is dead.
Okay.
So there is a guide that is used for determining impairment, and is called the American Medical Association Guide to Permanent Impairment. And the most current issue is the 6th edition. And so there is a criteria involving the history, the physical exam, results of medical testing that can show injury, that are used in a formula to determine what is called whole person impairment. And after the patient is completely healed, if they're left with an impairment, this impairment can then be used for patients to obtain a settlement based on the fact that they've been injured permanently, and they aren't able to do things that they previously were, and that they, in all likelihood, will have pain and suffering that they didn't normally have. So
you use the AMA guides to impairment rating? Or do you use those?
Yes, we do, and all our physicians here at the Florida Center for Back and Neck Pain are certified in impairment ratings with the AMA Guides 6th edition. Okay.
I take it you will evaluate the patient, and after treatment you'll evaluate the various tissues, whether there's nerves and discs and joints and all that. And then I take it if you see any limitations, permanent limitations, then you take those and extrapolate those into the guides. Is that right?
That's correct.
Okay. So that's what you'll do as the treating physician, is essentially try to get him back to no impairment, obviously, but
right.
If not, then you will specifically create a number from that injury out of the guides. Is that right?
That's correct.
Okay. So that encompasses the medical category of one component of compensation then, right?
Correct.
Okay. Let's go to the next category of wages lost. What would you have to say about wages lost, or if they had if somebody had to retool because they couldn't do their job anymore? What would you have to say about that as it applies to compensation?
If a patient's unable to work during the time of their injury, they should be entitled to compensation for lost wages. And this number of lost wages is oftentimes factored into the amount of settlement based on their permanent impairment, or factored in with their permanent impairment. And frequently, if patients have had to retool their job, so to speak, in other words, if they worked in a warehouse and could no longer work in a warehouse and have to change their job and be educated in a different profession, that oftentimes this will reflect their impairment as well, and oftentimes will increase their settlement.
Mm-hmm. And then how about pain and suffering? How does pain, you hear a lot of that. What's pain and suffering? What exactly does that mean anyway, pain and suffering?
Well, pain and suffering is something that's unpleasant.
Yeah.
Pain and suffering is considered a level of compensation, monetary compensation, for the fact that patients have had to put up with something very unpleasant as a result of an injury that was no fault of theirs.
Mm-hmm. And how about pain and suffering as it relates to their activities of daily living? How does that relate to compensation?
Well, following an injury, sometimes patients can no longer put on their socks and shoes, or perhaps they cannot shower, or they have a balance difficulty and they have frequent falls. They can't feed themselves. Depending on the scope and the type of the injury, inability to perform routine activities of daily living can affect their compensation, and usually it will increase.
Mm-hmm. So that will definitely play a role in increasing the compensation, the restrictions of activities of daily living.
Yes, it will.
Okay. And then how about the person's age? How will that play a role?
Well, as these, if a person's impairment affects these activities of daily living, the younger the person is, that means they'll have more years to have to deal with this impairment. And so the general rule is the younger the person and the greater the impairment, usually the greater the compensation.
Mm-hmm. So the younger they are, they're losing essentially earning power years, I guess, is the way it's looked at.
Especially if they've had unable to do their previous job and have to perform different jobs that of equal or particularly lesser earning power.
Have you had patients like that?
Oh, sure, yes. Over the years, it's not uncommon for severe injuries to, especially if they've done hard physical labor, to not be able to perform that anymore.
Mm-hmm. And you have the ability to, not obviously treat them as a physician, but you have the ability to document all of these categories through the histories and the physical exams and help create this number and help in the compensation of the patient. Is that right?
That's correct. Here at the Florida Center for Back and Neck Pain, we consider ourselves to be patient advocates. And so, yes, that is something that we will do, but because of our level of documentation, and it's very uncommon that we're actually asked to do that.
Okay. So you essentially give all the tools that are needed from the first swing, so to speak.
That's correct.
Okay, good. Anything else relative to compensation that you would like to add in how somebody is compensated in an automobile accident injury? That pretty much covers it.
That pretty much covers it.
Okay, so essentially you take the medical expenses and the medical limitations, then you add in a formula with wages lost or altered, and then possibly pain and suffering or retooling or education. Also factor in their age and their occupation. And who does this I guess the attorneys do this formula. Is the attorneys put all this math together and put it in a formula and come up with a number?
No, that's the physician who's putting that all together.
Is that right?
That's correct.
Okay. And you do that for patients?
Absolutely.
Okay.
And we frequently do.
Okay. All right, very good. And that was very informative. Again, this is Dr. Paul with Car Injury Care TV, and we were talking with Dr. Greg Hollstrom. He is a chiropractic board certified neurologist here in Largo, Florida.